like to thank the organizer for this invitation, and especially the Xtraordinaire Association. My name is David Cheillan. I'm a medical biologist in the Hospices Hospital of Lyon, and I am in charge of the national coordination of the newborn screening lab in France. My topic today will be to give you an overview of the situation of NBS in France. Here, my links of interest. As you know, newborn screening is one of the most important public health programs across the world, and we consider that almost 30% of newborns were screened for at least one disorder. 99% in Europe, North America, or Australasia, until only a few percent in low-income countries. In France, there is 68 million inhabitants and approximately 750,000 newborns per year. Our country is divided into 12 regions and few overseas territories. The NBS program starts in 1972 and is mandatory. Actually, we are screening for 13 conditions on the beauty cards and on one clinical disorder, hearing disability. The global exhaustivity is over 99–95% for biological screening and 99.5% for deafness. The history of newborn screening in France starts in 1968, and conditions were added during years until the beginning of the new century with cystic fibrosis in 2002. Still to this date, the program was late, but recently new condition has been implemented with the addition of MCAT deficiency in 2020 and the new 7 new inborn error of metabolism in 2023. In France, the newborn screening program is piloted by the Ministry of Health with the newborn screening National Steering Committee, coordinated by the NBS National Coordinating Center, completed by an epidemiological and biological commissions. Locally, we have 7 newborn screening regional centers with 16 newborn screening labs, screening for 25,000 to 180,000 newborns per year. The global cost of the program is around 18 euros for biological program and 20 euros for hearing screening program. As I said previously, NBS is mandatory in France and very strictly regulated by the law. Recently, the notion of NBS is enshrined in the new bioethical law promulgated in 2021. Moreover, even algorithms are inside the reglementation. Regarding the situation of NBS in Europe or in the world, show that great disparity on the number of diseases screened per country, from less than 6 conditions to more than 30 conditions. In this paper, published in 2021, describing the landscape in Europe, we can see the large heterogeneity observed across the countries. France was at the 22 position, but with the recent extension, the rank will be the 16th position. However, France is always late. What could explain such disparities between countries? Indeed, all the newborn screening programs are following the Wilson and Yevner criteria, edited in the late 60s, but their condition of application could differ according to different points. For example, the frequency of the pathologies in the country, the availability of treatments in the country, or the economic level of each country. Recently, some initiatives have been taken by the International Society for Neonatal Screening to try to offer some solution towards an harmonization in Europe. Moreover, we have also participated to a study which gives new tools to evaluate disorder candidates for implementation. But finally, each state remains sovereign for its own health policy. In France, on the question of NBS extension, we could consider that the HAS, la Haute Autorité de Santé, a kind of health technical agency, is in the core of the system. Indeed, in its mission, HAS is in charge of the recommendation for implementation of new conditions, the monitoring of NBS program, the development of methodological tools for evaluation, and the production of information documents for parents or health professionals. Very recently, in 2023, HAS has published a new methodological guide for the evaluation of a screening program. This tool, based of course on Wilson and Jungner criteria, should be used when the question of extension of NBS program is asked. So, in France, what's next in the near future? There is two main programs on the table. First of all, the generalization of sickle cell disease at the entire French population in the beginning of 2024. Second, probably extension of spinal muscular atrophy and severe immunodeficiency disorder in 2025 with a pilot study for SMA, which is in progress, the DEPISMA study, in 2 regions of France. Some other perspectives are open, such a pilot study for lysosomal storage disorder in progress in the Normandy region. But to date, no discussion is open to implement creatine disorder and especially GAN deficiency in the newborn screening program in France. Finally, the future is certainly driven by genetics with the application of whole genome sequencing for newborn screening. A great number of studies have been started across the world, and in France, a new study named Perigenomed will start shortly. These new developments will offer new exciting possibilities for NBS in the future. I would like to thank you for your attention and see you for the discussion. Thank you very much.